Okay, so now I'm going to show you a practice which will help you to support your healing after a soft tissue damage. Just to recap, to know what soft tissue damage is, if you haven't seen our recent Ion Healing, in the most general sense of the word, soft tissue damage are four things, or soft tissue are four things: our ligaments, our tendons, our muscles, and our fascia. In this specific practice, we're going to look at ways to support the healing of our knee soft tissue around the knee, in and around the knee after an injury. This practice will also have a supporting function for the hip and the ankle, but most specifically for the knee. Before we head into the practice, I just want to mention the two main directions that this practice is going. When it comes to soft tissue damage, we want to keep in mind two things. First of all, working on our proprioception, which is our ability to know where the body is in space, even with our eyes closed. And secondly, we always want to work on active engagement or active mobility of our muscles. Because when it comes to soft tissue damage, very often it actually is, especially when it comes to the knee, it's related to our ligaments, our tendons, and the fascia. So what we want to do is bring our muscles in to support the knee structure. These will be mainly the muscles of the upper leg, the quads, the hamstrings, and also our glutes. So without further ado, let's hop into the practice. The first one I want to show you is an amazing way to not only have an active engagement of our muscles, but also to work on our proprioception. And we do this through the very simple concept of balance. Let's say that there is an injury on the right knee. I want you to feel for yourself in your own body if you are actually ready for these practices. If your injury is less than 6 to 8 weeks ago, I would not recommend these practices, but I would ask you to check out our video on gentle remobilization practices after an injury. And also, I would not recommend you to do this practice if, when you just put the weight on the leg that was injured, you experience any sharp pains. Please do not proceed, but take it easy, wait a little bit longer, have more patience, let the structures heal a little bit longer through, for instance, gentle mobilization and a lot of rest before coming into this practice. Okay, so we're going to start with our right leg, putting our right leg on a firm underground. And we want to, first of all, so we're going straight into the balance. So here we are already with our proprioception in mind, coming into a balancing posture. And now I want to add the active engagement of the muscles. To do this, I will lightly bend the knee. This takes us out of the so-called knee lock, which is a way to actually save energy by using less muscles. And now we're going to slightly bend the knee, which automatically already will engage the muscles. You can feel it for yourself. And just come onto that knee with a slight knee bend there. And feel already how it feels to have an engagement in those quads, in the hamstrings, and in the glutes, the bum muscles. To make it, to bring more of a juiciness into the proprioceptive training and into our active mobility, not just the active engagement, we're actually going to do this, but then with movement. So it's going to look like this. Balancing on our right leg, the knee as far as possible back, which brings an extra engagement of the glutes. So you will need to bring your chest slightly forward to balance. Really check, make sure your knee is not going too far over the foot. And now with the other leg, we're going to move forward, tapping the ground, side and back, side and forward, side and back, side and forward. Let's do that one more time. Side and back, side and forward. If this is already quite an easy practice for you, I'm going to show you a way to make it a little bit more difficult. We're going to do the same thing, so slightly bending the knee, but now we're going to come more forward with our chest and see if we can bend even so slightly more through the knee without having the knee move forward towards the toes. So I'm coming deeper with my chest towards the ground. This automatically makes my buttocks have to go more back, so it's going to bring a nice engagement of the glutes there. Lifting our other leg off the ground, and let's do the same. Forward, side, back, side, forward, side, back, side, forward. One more time. Side, back, side, forward. If at any moment you need just to regain a little bit of your balance, just allow your foot to rest on the ground to support that. Another way is just to make sure that you're close to a wall. So if ever while you're doing it you need some balance, just make sure you have your wall for safety, for security. We always want to do this on both sides. It's very important when we work on balancing postures to do both sides of the body, even if the injury is only on one side, so that we properly train both sides of the body. We properly train both sides of our coordination as well. So let's do the other side. Now our left foot finds a stable place on the ground. Very slight bend in the knee there. The right foot comes off the ground. Buttocks are back and forward tap, side tap, back tap, side, forward. 2 more times. Side, back, side, forward, side, back, side, forward, side, back, side, forward. Now if you want to again make it a little bit more difficult, remember we're going to bring our chest slightly down, push those buttocks back so the knee still stays as much as possible above the ankle. You'll feel a good firing up of the glutes there. Very good for our core balance. And finish the exercise 3 more times in this deeper posture. If at any moment there is pain in the injured spot, please stop. Please be patient with yourself. Take it easy and continue once you feel a little bit stronger. Now for the second exercise that you can do to support the healing after soft tissue damage, especially to the knee, is as follows. So again, we work with balance, key in proprioceptive training. We're going to bring a slight microbend in our knee to make sure we have an active engagement of our muscles and come into the yogic posture, Warrior 3. You don't have to do the full posture. You can also just do it very lightly, lift your back leg up. Whatever helps you in order to hold balance. If you need, you can use the wall. It's completely okay, because what we want is actually to bring our awareness, to be able to bring our awareness to the knee joint. So find the posture, the position, the option that is best for you in this moment. So I'm going to show you on the right knee, slight microbend. I'll just bring my back leg up very so slightly. And what we want to do now is bring an aspect of mobility in there again. This is what's really going to advance us in our healing and inside the active engagement and proprioceptive training that we're doing here. So slight micro bend, my leg muscles are engaged, and what I'm going to do now is bend ever so slightly through my standing leg while still keeping the knee above the ankle as much as possible. So this means I really have to engage my glutes again. And coming straight, coming down, and coming straight. Let's do that one more time. Coming down, and coming back up, coming straight, and stopping there. Again, make sure to do it on both sides. I will do my left side as soon as I finish with you here. And I hope these practices help you with your healing. Again, I cannot say and underline it enough. Please be gentle. If at any moment there is any pain, especially sharp pain, stop the practice immediately. There's probably a need for more patience and more gentle mobilization practices before coming to these a little bit more intense and strengthening practices. Let me know in the comments below if these practices supported your healing, if they supported your practice, in which ways, and if there's any other practices that you would like us to focus on in our upcoming videos. Would be super happy to hear. Wishing you a super beautiful rest of your day. Goodbye.